3 News Now Web Extra.
Christine Mitchell, Christine, Mitchell.
Okay, and speak on this.
Yes, we are all female physicians here in Nebraska, and we all happen to be moms. So that's actually the title of the group, Physician Mom Group Nebraska. So.
And talk about how the discussion on masks in schools ever came about on this part of the group.
It's actually come up quite a bit by various people, I think. We're from all specialties, so I think we all kind of have opinions on it, and we're from all different districts too, across Omaha. So it has come up on the platform a lot.
And when talking about numbers, it's statewide, right? So how many folks are a part of that group, you know?
Over 700.
Okay. Talk a little bit about why the Delta variant is different and why masks in schools have a little bit of a different sound now than maybe it did last year.
Yeah, I can answer that question.
Can you say and spell your name?
Yeah, sure. Melissa St. Germain, Melissa StGermain. And I'm a pediatrician here in Omaha. And the Delta variant has really changed what we know about COVID. It is way more infectious, about 1,000 times more viral particles floating around than the previous version of COVID-19. And what that means is that it's about as contagious as chickenpox. So when you think back to before people were able to get a vaccine for chickenpox, there were chickenpox parties, right? Every time it would go around school, it'd be the whole entire class out for 2 weeks. That's what we're looking at with this Delta variant.
And why would masks make a difference?
Masks are able to catch most, not all, but most of those viral particles as they're coming out of someone's mouth. So if you've got a piece of cloth, preferably a surgical mask, but a piece of cloth works pretty well as long as it's tight fitting to the face, that'll catch most of those viral particles so that they can't get out and infect someone else.
And the difference between a mandate and a optional is what in your guys' experience?
It gets sticky when you get into that delineation, because in healthcare we don't usually make mandates. We make recommendations. We make suggestions. You know, when we say something is recommended, that's to us a mandate. That means that is the best option for our patients at the time.
Okay. And do you think it would be safer for them to mandate at this point, and why?
I do. The recommendation from both the American Academy of Pediatrics and from the Center for Disease Control within the last 2 weeks have come out that masks are recommended for all students and staff who are going to be in schools, because it's so many people in such a closed space and it's really, really hard to social distance. We've discovered that last year. You can't have 6 feet apart between every desk. The kids don't all fit in the classroom. And so that's basically the CDC and AAP's way of saying we need to mandate masks without using that political term, because that's not usually the language that we use.
My understanding is there's a lot of concern with the Delta variant that vulnerable people could be at risk from this as well.
Yes, and I can answer that. So I have a husband who got a heart transplant 5 years ago. And he's actually been hospitalized about 19 times for infections over the last 5 years. And unfortunately, we're seeing that the vaccine is not as good in people who are immunocompromised. And so, as a mom and as a physician that has 4 children, part of my concern is my children going to a classroom with nobody wearing masks, and the plan being if there's a positive, nobody's going to quarantine except for the one sick child, which is also against the CDC recommendations. And then my children could potentially bring COVID back home to my husband. And not only would they have to deal with my husband being sick or, God forbid, dying, they would also have to live with knowing that they brought it home from school and it was potentially a preventable illness.
When you hear, I don't know who would want to take this one, when you hear school administrators, leaders say things like, well, we might want to just see how this goes and maybe react after, what goes through your mind as a physician?
I would say that we don't want to be reactive. We have have a reason now, the education now, to be proactive and hopefully keep our kids in school, our parents at work, and prevent another shutdown. Let's not wait for this to get worse.
And when you see what Westside Schools did, where they at least did the through 6th grade mandate and recommended for anybody older, what do you make of that decision and the decision that folks are still making over the next several days?
Yeah, so my name's Emily Didel. I'm a board certified pediatrician. I specifically work on a pediatric transplant team. And my children go to Westside, and I was at the Westside School Board meeting. And I'm relieved for my own kindergartner, but I also take care of a lot of kids who fall outside of that range. And their parents are extremely concerned and emailing me daily about it because in their minds, they can vaccinate their kid, but not all kids are healthy. And all kids deserve an education. All kids deserve to be able to go to school, have social interaction. Every single one of the parents here thinks that school is important. Keeping schools open is important. And we don't view masks as a way to keep people apart. We view them as a way to keep people together. And so while I was very happy to hear that my kindergartner was gonna, be in a place with a mask, I feel horrible for all of my patients' parents who are still having to make that decision for their children. And I think that as a community, we should care about all of our children. We should care that all of our children have the opportunity to have an education. And that's actually a requirement, is that we provide an environment where all children can have an education. So that, I think, is all we're really asking, is to open schools in a way that we can do that this year.
Today, the governor told our camera crew that he was still against any mandates in schools for masks. And when you hear him talk like that and other leaders, what does he need to know that you don't think he's hearing from maybe his closest advisor? Or what is he not listening to?
There's more than mortality. You have to think about the morbidity, or when we say morbidity, we mean the other things that can happen to people from a virus. So I will honestly say that my specialty, we've been remarkably protected in many ways from COVID-19. I work in gastroenterology, but I see lots of viruses that don't kill kids and they leave them with their health permanently altered. And I would encourage you to talk to some of these other women who can speak more specifically to the way that COVID-19 permanently alters children's health. But there is so much more than talking about mortality when we talk about the effects of a virus on the body.
Yeah, I'm happy to.
Please tell me your name.
Yeah, I'm Rachel Johnson, RACHELJOHNSON. I'm a community internist and pediatrician in the community. I think one of the biggest things that I've seen being a community provider, and why I feel it's so important to keep our kids in person in school, is I've seen a significant increase in anxiety, depression, and suicide attempts in my patient population, specifically in my children that have been remote schooled this past year. Hands down, it's been worse in my remote school patients. And if we actually have good studies specifically over the past 6 months that have looked at loneliness, and loneliness seems to be the highest risk for adult and adolescent depression and anxiety and suicide attempts. And so I feel very strongly, as a community, we need to absolutely prioritize keeping our kids in schools and sending our kids back with no masks, with the Delta variant, which has an R0 of 8, meaning that for every one person that's infected, they will infect 8 other people, versus our wild type, the previous COVID that we saw was for every one person that infected, only infected 2. So this is going to spread like wildfire through our schools if we send kids back with no masks or optional masks. We are going to see our schools shut down, back in remote schooling. And me, as being a community provider who takes care of both adults and adolescents and children, I mean, we are just going to see such a significant burden of mental health and suicide on our patient population, especially our children. And another thing I think it's important, although the mortality risk is low for our children, right now, COVID is in the top 10 killers of our adolescent population, in the top 10, and we have a prevention for it. A vaccine to prevent a disease process that's killing our adolescents is now in the top 10. And also, the British Health Registry is now reporting that in the British population, they're seeing about 7 to 8% of their children are demonstrating long COVID symptoms. So 7 to 8%. We don't have that data as of yet here in the United States, but again, we seem to be seeing things a bit later as compared to the UK, and so I think we're going to see the same things here. In Britain, they're opening new COVID long care COVID pediatric clinics. I think we're going to be having to do the same thing here in the United States if we send our kids back to school with no masks and just see how things go. And with the way this Delta variant spreads, it's going to be too late before we know. It's going to be too late, and it's going to be everywhere, and we're going to have schools shut down. So I just feel very strongly as a community provider who cares for my patients, we have got to prioritize keeping kids in school, and that means masks.
I don't need to be on camera. I was going to say we actually already have a clinic for long-term COVID kids because it is affecting the kids in our state with MIFC and long-term COVID. One of the institutions in town already has a multidisciplinary clinic, so we're already seeing that.
Okay. And could you tell me your name?
Yeah, Alicia, Aleisha, Nabauer, Nabower.
And those kids that are suffering this, what are they actually facing?
So it's a variety depending on what they have. With MISC, or the multi-system inflammatory syndrome that we have been seeing, they can have problems with their heart function. They can get blood clots. We can see them get very, very sick. And fortunately, most of the kids recover in the acute period, but we're seeing the same mental health concerns, long-term fatigue, just not getting back to their full performance even months out.
Go right ahead.
I think what I would like our public officials, our superintendents to look at honestly is the data. We've had a huge increase in COVID cases and children under the age of 19 in the last several weeks. They now make up 26% of COVID cases in Douglas County, which is the highest for all ages. And unfortunately, the highest proportion is kids aged 5 through 9. That's our elementary school kids. So that just stresses how important this is for us to be preventative. One thing that was brought up to me by one of the officials was, well, we had the option for summer school to do masks, and it worked out okay. And as one of my colleagues pointed out earlier when we were talking, that this virus, it changes, the pandemic changes, and we kind of have to change our policies with it. When COVID was, the spread was low, and prior to the Delta variant, then we were able to loosen things and make mask option for school. But now that the spread is higher, and now that we have the Delta variant, which as she talked about is so much more contagious, and it's infecting so many more of our kids, now it's time that we make the restrictions again, put the masks on, and see if we can keep school going all year, just like we did last year.
What can parents do who are afraid for their children but want them to have the school experience? What beyond obviously sending them in masks can parents do to try to help their children stay safe? What should they be sitting down and talking to them about before they send them back to school?
I'm Jamie Vitambas, Jamievitamvas. I have a now second grader with some reactive airway or asthma symptoms. And we've talked a lot about him catching, if he were to catch coronavirus, what that could entail for him and how sick it could make him. So we have trained him to understand that he needs to wear a mask. Even if his friends don't wear a mask, he needs to wash his hands. As soon as we get back from the store, he knows that he needs a hand sanitizer. If he sees somebody coughing, he stays away like the plague. And I think more people need to do that with their own kids. I think kids tolerate masks fine. I think it's more of a parent issue than a kid's issue, and I think more people who support masks need to be vocal about that and say, yes, we support wearing masks in our schools, and I think the officials need to hear that from everybody.
Should the adults go ahead and get the adults who are still fence straddlers, who care about their kids, but maybe are vaccine hesitant, how much could it help their kids if they go ahead and get the vaccine?
So I'm Allison Laplin, ALISON, LAFLAN. And so basically the more people that can get vaccinated, it creates barriers that COVID can spread through. And so we certainly encourage everyone who's eligible, but I have a second grader as well, and he can't get the vaccine. And so my husband and I are both vaccinated, and that's our best way to protect him and ourselves. It's just more people, again, anyone who can get vaccinated kind of forms more of a wall that COVID can't bounce around as easily.
And for people who are worried about misinformation and disinformation that they've accessed online about masks, what is the thing that you wish you could sit down and talk to? I mean, if you guys are already on Facebook, what have you seen that you wish you could knock down?
So I guess one of my biggest concerns is there's a whole lot of people who are not medical, have no medical background, who are saying like, well, I did my research. I have read this study and it says that masks are bad for kids and things like that. And it's like, part of our training as physicians is actually learning how to interpret these studies that get published, and if they're good, if they're applicable to our population. So without that background training, you just aren't qualified to really read an article and kind of interpret it yourself. And so I guess my wish would be that people would talk with their physicians. Honestly, they're the best resource. They know their patients the best. And so talking with your primary care provider is probably the best resource to obtain accurate information, and definitely staying not online. Because there is a lot of stuff on there that unfortunately that circulates just as fast as the virus.
What am I not smart enough to ask you guys about that you want to be sure to share?
Go ahead.
I was just going to add, I think everyone wants to do, all the parents in Omaha and in all of these school districts want to do what's best for their kids. And it is sometimes hard to figure out what that is. And that's why we rely on the CDC and the AAP and these big organizations who have really, really smart people looking at this data and making these recommendations. And so we are here to help interpret that for you. It is hard if you've been online and seen totally opposite viewpoints to know where the truth is, and we're here to help answer those questions. We want to help answer those questions. So please call your doctor and talk about the vaccine and talk about the masks and why they're safe and why they're needed.
Did you want to talk as well?
Yeah, I just wanted to speak to, you were talking about, and I never spelled my name for you, it's Dietle.
Thank you.
You were talking about parents getting vaccinated. And I know a lot of our parents are of childbearing age, and they've heard a lot of misinformation about the vaccine as well, as far as safety in pregnancy and your ability to get pregnant afterwards. And from a personal standpoint, I'm not an OB, but I can say I got vaccinated. I am pregnant. My child is healthy. My OBs were all in favor of me getting vaccinated prior to pregnancy, and I encourage everyone to do it, and for that not to be a reason not to get vaccinated. So please, everyone should talk to their doctor and see if they are suitable for the vaccine. And I can tell you, taking care of immunocompromised children, pretty much everybody is eligible and should be getting the vaccine. There are very few reasons not to.
Okay. As silly as it sounds for the visual here, how many of you think that schools ought to be requiring vaccines?
Vaccines? I mean, that's hard, but yeah.
And how many of you think they ought to be requiring masks? Okay. Thank you for your time. Thank you for sitting out here with us. I understand there is an OB in the crowd.
There's three of us.
I'll tell you.
Yeah, please speak to it. But I wanted to, I know a lot of people have a lot of misinformation, and I just wanted to say, I'm pregnant and I did it.
Misinformation and
And
disinformation.
please tell me your name again.
So Tiffany Summersheely, TIFANYSOMER-SHELY. And I'll have to echo what was just said. You know, as physician parents, we have a very individual or a very interesting place, because we have one foot in the educational community because our kids are there, and we have clearly priorities based on keeping our kids healthy, but we also have this other foot in like the medical community. And so we also have a perspective that incorporates like the infectious etiology and how fast it spreads and stuff on the own. So we have this really interesting perspective that we can comment on both. And I think that for both our concern about keeping our kids safe and also our community safe, wearing masks and vaccines really cover both. They really are good for both sides. You figure kids in elementary school have young parents, and young parents frequently get pregnant. And so some of these kids are going to go home to a pregnant mother. Pregnancy in and of itself is a risk factor for severe COVID illness. You're 3 times more likely if you're pregnant to have severe COVID disease. You're 3 times more likely to be on a breathing machine, and you're unfortunately more likely to die as compared to women your own age if you're pregnant. So you're not only protecting your child by having them mask and if they're of age getting vaccinated, but you're also protecting the families. And once you protect the families, then you're also protecting the community at large. So it's bigger than the one kid wearing masks in school. All the vaccines are completely safe and efficacious in pregnancy, and I would encourage all women of reproductive age to get vaccinated. And I'd also encourage all the kids in school to continue to mask as well.
One of the things you just triggered in me that I wanted to make sure I asked, the younger group is still the most vaccine hesitant, or at least they have sought fewer vaccines than any other age group. What do they need to know about the importance of getting vaccinated that maybe those 12 to 24-year-olds are not understanding?
And so as far as the vaccines go, I think kind of, especially when COVID first started, there was kind of this mentality that, oh, well, only old people or those with medical comorbidities die of COVID. Otherwise, it's just a cold or it's just the flu. And unfortunately, that may have been a tiny bit more true with the original COVID. I still didn't want to chance anything, but this Delta variant, we're seeing younger, healthy people get sick and end up in ICUs with severe COVID and or die. And so I sort of refer to COVID as it's kind of a disease of chance. You may not get many symptoms, you may die, and it's anything in between. It's not a binary, you get it and you're fine, or you get it and you die. As was mentioned before, you can have devastating health outcomes that we don't think are reversible, as far as like pulmonary damage. People get strokes, things like that, even young people.
And the high school kids who think they're bulletproof in particular, why is it important for them to look at vaccines and masks if they want to see their high school year finished?
So again, the recommendations that were made by not only the national AAP and the CDC, but also our local experts, it was with the number one goal to keep kids in school. And so I have been telling everyone that I know that the best way to minimize COVID disruptions is to get vaccinated. And so if you're not vaccinated, you're just subjecting yourself to, missing out on the 10 days of school or whichever that you have to quarantine. Even if you could prevent that from happening, I think that's definitely worth it. And then also like kids who are athletes, things like that, we've seen them get sort of this long COVID symptom that makes them very exercise intolerant, and so it's just, you never know what's going to happen to you specifically with a COVID infection.
Yeah. And Doc Boyle, I know we've talked before a long time ago, but talk about the political challenge of trying to communicate during this pandemic with people who have political agendas that may not line up with what's needed to be done.
So I'm Maureen Boyle, Maureen Boyle. I'm an OBGYN doctor in the area and also an elected official. I'm one of 7 Douglas County commissioners. And so what I've found is it's really fascinating to be on a board like this and see the politics behind what the medical facts are. And they really are not congruent at all. So I've been very vocal on the board to state that, for example, even just this week, what are we waiting for? Are we waiting for a child to die before we all decide that it's okay to mask and get vaccinated? Unfortunately, that's the reactive approach that seems to be okay according to the politics of it. I think there's I feel a huge demand and a lot of support from constituents who contact me and patients who contact me to state they want the masks. At the same time, I get other folks that send in and say, you're no expert, so don't recommend a mask. And I acknowledge I am not the expert because I'm not the CDC, I am not the AAP, I am not University of Nebraska Medical Center, but I am a physician and I make these recommendations to my patients all the time. So I do have some credibility there on that side of it. What I do find is it's a tough envelope to push because we may be using facts as we should be, but the pushback you get from the background politics of it is pretty amazing to see sometimes. Sometimes decisions can't be worded or put forth a certain way because there are political issues that have to occur down the road, and you don't want to burn bridges at this point. You need to build those relationships. So to burn the bridge now means down the road when you really have another initiative that needs to be put forth. From a political standpoint, it's political death. And so I would rather, to be honest, take a political death than a personal death. So I'm willing to put myself out there as a physician and a county commissioner to say, we need masks, we need vaccines.
Thank you all very much. Anything I didn't think of to ask?
I wanted to say one thing on what you were saying about not being an expert, because I think it's something that's important for how we all look at things. So, in the medical field, we all specialized in different things. We all have areas that we are experts at. And we do know what we know, and we also know what we don't know. Within the hospital, we rely on each other. We're partners, and we know who to ask the right questions to. So when we have resources in town, like the UNMC infectious disease doctors who are world renowned, and they tell us something, we have relationships with these people. We know these people. We know they're excellent at their job, and we trust them. And so I know what I know, and I know what I don't know. But I also know who to ask. A truly intelligent person has excellent advisors.
How long have you guys been trying to get attention from the school boards? I mean, have you each all gone to your various school boards?
I guess I would say not very long.
Okay.
Because I sort of expected when all these expert bodies, national and local, came out with recommendations. As a physician, I was like, oh, okay, perfect. They're gonna just have masks because that's what they said. And so then when I realized that wasn't happening, that's when I was getting quite worried. And that was my biggest message to the superintendent of my district, whom I spoke with, was that it feels as if we're trying to prioritize feelings of politically charged, emotional aspects, and nobody likes wearing masks. Like, we don't like it, but when so many unified expert bodies on infectious diseases, pediatric health, public health, all come together and make this solidified recommendation, like, to me it just seems like it is just silly not to listen to that. And it makes me worried, especially my kid is in a public health district, that public health districts aren't following scientific recommendations. That sort of goes against not only keeping people protected, but kind of discredits the education that we have gone through to become experts.
Ask the question about like young kids and adolescents or people who think like they're invincible.
Right.
And I'm super healthy, and I'm not a smoker, and I'm not morbidly obese, and I don't have underlying health conditions, and I exercise every day, and I eat healthy, and I'm not on chronic medications, and I almost died. I got COVID. I was exposed by somebody that didn't know, and I had multiple pulmonary emboli in both lungs, and I was hospitalized in the COVID unit. So I always tell people, what chance are you gonna take? What virus are you gonna get? If that can happen to me, that can happen to anybody, and I'm not gonna take that chance with my kids or my family anymore. So it's really frustrating to see people be so lackadaisical about it and base all of their decisions on emotion instead of scientific data. And that's been the hardest part for us, for our family, knowing what we went through. And they spoke to it too. Is the only outcome death, right? Is the only outcome death? Like, what about all the other stuff that happens? What about all the time that's missed from work and income and pulling our kids from school and long-term morbidity? It's like, why is the only outcome death for these people? So, I don't know. Yeah.
No.
sorry. My name's Brianne, B-R-I-A-N-N-E, Kling, K-L-I-N-G. I'm an OBGYN.
You said it much more eloquently, but my husband likes to make the analogy, it's like, would you take your cat to a mechanic if they were sick? So if the answer is, well, duh, no, then why are you taking your medical information off the internet? Why aren't you listening to the AAP, the CDC, our colleges, the American College of OBGYN or the Society for Maternal and Fetal Medicine? Those are the people you look to. You don't call someone who's not an expert. So if I'm not an expert in internal medicine, I call my friends. And so people should be paying attention to the AAP and the CDC and not their Facebook buddy. Because you have to understand that they're coming from a different place, right? This is truth for them. And so you have to take that as their truth, and you have to address that, understanding that these are their beliefs. And so you have to do it with kindness. You can't argue. Shaming them certainly is not the way, but if you do it with kindness and you try to come from a place of the right place in your heart to let them know that this is really the reason that, because I care about you, I'm going to give you this information. And it's not me saying this, I'm an expert in what I know, and I know what I don't know. And what I don't know, I look at to experts, and this is why I'm asking you to do this, because I care for you and I want you to stay healthy. And I think that you get a lot farther with meeting people where they are, and trying to, because you're not going to change your mind with fighting with someone, or you have to do it with kindness, and I think you're going to convince them. But yeah, you have to understand where they're coming from.
I think that we're all still learning with this, and I think that we all hope for the best scenario. But having been in medicine, we've seen a lot of things go a lot of different ways. Sometimes a patient is convinced everything's going to be great and we think it isn't, and it is. And sometimes we think everything is going to be awesome, and we come in and a patient is on their deathbed. And you can't always know what's going to happen, but what you can do is you can follow what evidence you know, what data you've been given, and you can follow that. You can't always base things off of this one time this happened, or we were safe last time, because the next time you might not be. It's like the person who drove home drunk. They got home fine last time, that's great. That doesn't mean that you should keep driving home drunk. So when I hear, well, we did great last year, I am so thankful for that. And I don't want anyone to think that we aren't thankful for all the kids who made it through school safely last year. Our concern is things have changed since last year, and we want to continue everyone being safe this year.
If they don't require masks, what will be a signal to you that things are going very badly very quickly?
Honestly, we're already there. We're already heading in that direction. We've seen an exponential rise in COVID cases in Douglas County at Children's Hospital over the last 2 weeks. We're already knocking on that door, which is why it's so frustrating when administrators say they want to wait and see. We're already there, guys. We're already back into the orange to red zone. Our hospitals are full. We're back up to 3 COVID units at the Med Center. Children's isn't full of COVID patients, but it's full. We don't have any room to take a whole lot of COVID patients. We'll be diverting out of state if that happens. So that's why we're all scared.
And I will say, just like I talked about with my husband being immunocompromised, I've actually thought about keeping my children home the first few weeks and seeing how it goes. Unfortunately, they're not even offering remote learning this year. I was able to keep half of my kids home on remote learning, and the other half went to school because they didn't do as well with remote learning last year. So I have to admit, if masks aren't required, I'm not sure if I'll even send my children to school. There really is no other options though for people. It's either you quit your job and homeschool your 4 children, or you send them and keep your fingers crossed that they don't die. So this is a real thing that a lot of people are thinking about. A lot of parents have cancer. They have primary immunodeficiencies. They're on medications. They have chronic conditions. And there's a lot of people that are very scared right now, not only for their children, but for their spouses. I would like my husband to live, especially when this is preventable.
My name's Stephanie Hartman, S-T-E-P-H-A-N-I-E-H-A-R-T-M-A-N, and I'm an internist here in town, and I think, you asked a question earlier about the political tone and what we would hope. And I think one thing that we've mentioned a lot today is that we all look at data, and that data is so important in a lot of medical decision making. And I think you'll also hear a lot of emotion out of this group because we care a lot, not only about our families, but a lot about the community. And so one thing that I think, we really need in this state in particular is that data back on a reliable, real-time basis in all the counties, so that we will know how to make the best decisions. And the fact that it's not coming in quite as transparent or as quickly as it was when we had a state of emergency declared really does kind of hinder some of the ability of even the experts in the community to continue to make real-time recommendations.
Just to echo off what Stephanie said, I think that the thing that I think we're all here because we do care, and we're not here because we have anything to gain. I mean, we realize that if we put ourselves out there like this, that there might be some backlash on us as people. And I think we're willing to take that risk just because we care about Omaha, we care about Nebraska. We love our city and our state. We love the people that we take care of and the people that take care of the people we take care of. And so we're here because we love people, and we truly are here because we care. And we have absolutely nothing to gain from this other than we want to save our children, our adults, and our community.